Welcome back. Today we're doing a deep dive into something that honestly sounds pretty dry on the surface. Tort reform. Liabilities, insurance premiums, damage cap.
Yeah, it definitely sounds like something for the legal eagles or the insurance folks.
Right. But what if a law passed purely for, well, economic reasons, didn't just tweak costs, but actually, according to the sources we've analyzed, triggered this quiet, long-running public health crisis?
Yeah.
One costing thousands of lives.
It's a really startling argument. And it completely reframes the specific piece of Florida legislation. We're talking about Florida Statute Section 768.21, passed way back in 1990.
35 years ago.
Exactly. And while the talk then was all about, controlling lawsuit costs, the sources we're looking at argue its effect over decades has turned it into what they actually call a state-created hazard.
A hazard because of its impact on safety and accountability.
Precisely. Because of the unintended or perhaps unforeseen consequences on the state's ability to see and correct medical errors.
Okay, let's unpack the law itself. What did this 1990 statute actually do? And how did it single out certain people?
Well, it created what the sources term a legislative exclusion. Basically, the law carved out specific groups of people, preventing them from filing wrongful death claims for what are called non-economic damages if the death resulted from medical negligence.
Non-economic damages. Remind us what that covers.
That's the really human cost, right? The grief, the mental pain and suffering, the loss of companionship, the emotional toll. It's everything but the lost wages or medical bills.
And who got excluded?
3 specific categories: unmarried adults, people without any children, and parents whose adult children die.
So let me get this straight. If, say, my married brother dies because of a clear medical error, his wife could potentially file a suit, seek accountability, get those non-economic damages.
Correct.
But if my unmarried adult sister dies from the exact same mistake, same hospital, same doctor, I couldn't. My parents couldn't.
Under the statute, for non-economic damages, no. You'd be barred from the civil courts for that specific type of claim. The door is effectively slammed shut based purely on her marital status or lack of children.
Wow. Okay. The loss is identical. The alleged negligence is identical. But the path to accountability is just gone.
That's the core of the exclusion. And our goal here in this deep dive is really to trace out the causal chain that these sources describe. How does that legislative exclusion, that single rule, ripple outwards to cause systemic neglect, break down state oversight, and ultimately allow potentially thousands of preventable deaths to just happen in silence?
Okay, let's start with the big idea here. The intent was tort reform. Contain costs? Fine. But the sources say the lawmakers missed something huge about how the justice system actually works.
They miss that the civil justice system isn't just about punishment or compensation. Fundamentally, it functions as a massive data engine. That's the term the sources use.
A data engine? How? I mean, I think of courts, I think of judges and juries.
Right, but think about what a malpractice case generates. You get depositions under oath, detailed expert witness reports analyzing what went wrong, sometimes internal hospital reviews, or memos that become public. All of this creates a huge public record.
Okay, I see. It forces information out into the open.
Exactly. And that information exposes weaknesses in the system. It might identify a specific doctor with a pattern or a hospital with a faulty procedure. Critically, this data feeds back to oversight agencies like the Department of Health and informs other hospitals, other doctors, even medical schools. It helps prevent the same mistake from happening again and again.
So the 1990 exclusion blocked these specific groups from suing. It wasn't just stopping lawsuits. It was, like the sources say, sealing off that stream of corrective data.
That's the absolute key insight they present. Think of it like an engineering system. It's like deliberately removing critical sensors that are designed to warn you about potential failure.
Or like in public health.
Yeah.
It's like shutting down a disease surveillance network. You stop getting reports, so you might think the disease is gone.
Right.
When actually it's just spreading undetected. You've blinded yourself.
Okay, but hang on. Let me push back a bit here, play devil's advocate. Couldn't the hospitals themselves, or the state regulators, the Department of Health, AHCA, couldn't they find this information internally through their own quality control? Is litigation really the only way this information comes out? That feels like maybe an overstatement.
That's a really important question, and the sources definitely address it. They're not arguing that hospitals and agencies have no internal processes. Of course they do.
Right.
But the argument is those internal systems are primarily designed for, well, internal risk management, maybe improving things quietly. They rely heavily on voluntary reporting. Litigation, on the other hand, is external, it's adversarial, and most importantly, it's public. It forces disclosure, especially when an institution might, prefer to keep an embarrassing or costly failure under wraps.
So the external pressure is what makes the difference. That's the idea. When you remove that pressure for these specific cases, every potential case that can't be filed because of the exclusion represents a potential system failure that never gets fully investigated, never gets documented publicly, never gets studied. And over 35 years, that silence compounds. The system, as they put it, becomes increasingly blind to its own failures.
Okay, let's move from the theory of this data engine to the numbers, because this is where it gets really alarming. The sources point to figures used by the opponents of repeal to show the scale of this blindness.
Exactly. It's kind of ironic. Those who defend the 1990 exclusion, they often warn that repealing it would unleash 500 to 1,500 new lawsuits annually. They use that number as a kind of scare tactic.
To argue against changing the law. Look at all these lawsuits.
Right. But the sources we analyze flip that completely. They say, okay, let's take that number seriously. If there are potentially 500 to 1,500 cases each year that are serious enough to warrant litigation.
Then what does that mean from a public health perspective?
It means quite simply that potentially 500 to 1,500 Floridians are dying each year from preventable medical errors, but because they happen to be unmarried or childless or adult children, their deaths never trigger that public review process. They just disappear from the accountability system.
Wow. Up to 1,500 preventable deaths every year. That's the potential annual cost of this silence. That's staggering.
And then you project that forward. The law's been on the books for 35 years. So you multiply that annual number.
And you get this potential long-term toll. What's the range they estimate?
Somewhere between 17,000 and potentially 50,000 preventable deaths. Deaths that could have theoretically led to lawsuits and system improvements, but instead they vanished into administrative silence.
50,000 people. That's like a small city wiped out over time, not by a disaster, but by a legal loophole and exclusion.
That's the argument. These aren't just abstract numbers. They represent individual lives where the potential for learning, for discipline, for systemic change was just erased by the statute.
That scale, 50,000 potential deaths.
Yeah.
That certainly seems to meet the definition of a public health crisis. So let's get into the mechanics. How exactly does this law cause the failure within the state's own systems, like the Department of Health? The sources lay out this really clear causal chain.
Yeah, they break it down into 5 steps. It's very systematic. First, you have the legislative exclusion itself, removing whole classes of potential witnesses, essentially from the public record system of the courts.
Okay, step 1, the exclusion.
Step 2 follows directly. Silence data. Because those cases can't be filed, you lose all the information they would have generated, the discovery, the expert reports, the judicial findings. The raw material for analysis just isn't there for the state agencies.
The regulators, the Department of Health or AHCA, they just don't get the information they need. What happens then?
That's step 3, a broken feedback loop. Suddenly, these agencies, whose job it is to oversee safety, are forced to rely much more heavily on voluntary reporting from the very institutions they're supposed to be regulating.
Which sounds problematic.
The sources are pretty blunt about it. They say that relying purely on voluntary self-reporting is considered scientifically unsound in almost any other high-stakes field, simply because the incentives aren't aligned with transparency. Why report something that makes you look bad if you don't have to?
Okay, so the data stream is cut off, the feedback loop is broken. What's step 4?
Repeated errors. If deaths and injuries aren't examined publicly, if the patterns aren't identified because the data is missing, then the underlying problems may be a flawed hospital protocol, maybe an impaired physician. They just continue. They become institutionalized.
The system can't fix what it can't see.
Exactly. The same preventable mistakes happen again, maybe years later in the same place or somewhere else, because the initial error, the one that happened to an unmarried person, for instance, was never properly flagged and studied by the regulators.
Which leads inevitably to the 5th point.
The public health crisis. The cumulative effect over years and decades of all these unexamined, repeated errors adds up to population-level harm. It's a crisis built not on some sudden outbreak, but on the slow, quiet, steady accumulation of preventable harm enabled by legislative silence.
Now, for the families caught in this, they lose someone, they believe it was negligence, but the courthouse door is closed to them for non-economic damages. They're often told, file a complaint with the state. But the sources argue that this administrative road is like hitting a second brick wall. an administrative abyss.
It really is a fundamental shift in their role and power.
Yeah.
In a civil lawsuit, the family is the plaintiff. They drive the case, they have legal standing, they have tools like discovery to get evidence.
They're active participants.
Right. But the moment they file a complaint with a state agency like the DOH, they instantly become just a witness. They can tell their story, sure, usually filled with grief and emotion, but they lose all control. They're barred from actually helping prove the negligence in the way the administrative system requires.
So you have a grieving family member, not a lawyer, not a medical expert, trying to navigate this complex bureaucratic process, trying to translate their personal tragedy into the very specific language of regulatory violations and medical standards.
With no power to compel testimony or demand records, it's an almost impossible task for a layperson.
And what happens inside the agency? The sources describe this bureaucratic gauntlet.
Yeah. First, there's the initial investigation. Often the family's emotional account doesn't neatly fit the checkboxes the investigator needs. If it even gets past that, it might go to the state's prosecution unit.
Okay.
Now, the doctor or hospital on the other side, they have experienced defense lawyers, specialists in medical board cases. The family has usually just their story. The sources say the vast majority of these complaints are quietly dismissed at this stage, often just because the critical elements of negligence weren't articulated in the precise way the agency requires. The evidence gets lost in translation, basically.
It just falls through the cracks.
And even if, against all odds, a complaint makes it further, say to a probable cause panel.
What's the focus there? Is it about whether harm actually occurred?
Often, no. The focus shifts dramatically to procedural compliance. Did the doctor fill out the forms right? Was the hospital following its own internal checklist? Did everyone follow the timeline? It becomes less about the dead patient and more about administrative tidiness.
So the substance gets lost.
And if that panel denies the complaint, which happens frequently, the decision often comes back as a sort of sealed verdict, maybe with no real explanation given. The family is left completely in the dark, unable to effectively appeal or even understand why their loved one's death wasn't deemed worthy of action.
It sounds less like an accountability system and more like a system designed to make problems disappear quietly.
That's precisely the argument. It becomes, in practice, a mechanism of concealment rather than enforcement. This is what the sources call the dual denial. First, you're excluded from the public forum of the courts. Then, you're silenced and shut down within the state's own administrative system.
A double barrier.
It effectively guarantees that the evidence of negligence, the crucial data needed for learning and reform, almost never makes it into the public record for these excluded groups.
Let's shift gears a bit, from the mechanics of the system to the principles. The sources argue this isn't just about flawed procedure or legal inequity. They frame it as a fundamental breach of duty by the state itself, both constitutional and moral.
Yes, the constitutional argument is quite powerful. It centers on the Florida Constitution's Public Trust Clause. Article 2, Section 8, it explicitly states that public officers are supposed to act as trustees and servants of the people.
Okay, a duty of trust.
The argument is that this 1990 exclusion completely inverts that duty. Instead of the state acting as a trustee for the safety and well-being of all its citizens,
It's acting more like a protector for specific economic interests, like the medical industry or insurance companies.
that's the claim. That the law prioritizes reducing potential financial liability for those groups over the state's fundamental duty to ensure public safety and provide equal access to the justice system for everyone. And the fact that the legislature hasn't fixed this known defect for 35 years, the sources characterize that as a kind of ongoing constitutional abdication.
Wow. And then there's the moral dimension. The sources bring in Hannah Arendt's idea about the banality of evil, but apply it here as the banality of negligence. How did that work?
It's about how systemic harm can happen without anyone necessarily acting out of malice. It's impersonal. The investigator at the DOH is just following procedure, even if that procedure obscures the truth. The board members on the panel are just applying the statute as written, even if they suspect it's causing harm.
So no individual feels personally responsible for the outcome.
Exactly. The system itself takes over. It allows individuals within it to prioritize following the rules. Is this within policy? Over asking the fundamental ethical question. Is this right? Is this causing preventable deaths? Moral disengagement gets embedded into standard operating procedure.
It's like the system is designed to prevent asking the hard questions.
That's the interpretation. And that's the synthesis. You have a constitutional duty to protect the public trust being ignored. You have the public health duty being obstructed because the necessary data is systematically silenced. And you have this moral duty being abandoned through bureaucratic routine. That whole chain, the sources argue, is what makes the ongoing failure a true state-created hazard. It ensures the cycle of silence just keeps going, without accountability, without even much reflection.
So let's wrap up this deep dive. The core argument we've unpacked from these sources is pretty stark. This 1990 law wasn't really about reducing the occurrence of malpractice. It was about reducing accountability for it. And in doing so, it hobbled the system's ability to learn from its mistakes.
Right. The silence it created, that lack of lawsuits from certain groups, was mistaken for stability or success. But the sources insist it's actually pathology. It's a symptom of a broken feedback loop.
A system that can't see its own errors is doomed to repeat them.
Precisely. And the ultimate cost, they argue, is measured in those tens of thousands of lives whose deaths were essentially rendered invisible to the public record and the mechanisms of change. The sources really hammer home the point that accountability isn't the enemy of good medicine. Accountability preserves medicine by forcing it to improve.
So by actively blocking that accountability for whole segments of the population.
The state itself, through its legislative choices and its decades of inaction, has become, in a way, the negligent actor. Its inertia sustains the hazard.
Which brings us to the final, really provocative question these sources leave hanging in the air. For policymakers, for the courts, maybe for all of us. Since the legislature hasn't acted for 35 years to fix this, how should we ultimately judge this law?
Should we judge it based on its original narrow intent back in 1990, trying to balance economic policy, lower insurance rates, that sort of thing?
Yeah.
Or should we judge it based on its actual proven long-term consequence, based on the argument that it demonstrably creates the conditions for thousands of preventable deaths by systematically blinding the state to its own medical errors?
That really reframes the debate, doesn't it? It's not just about legal fairness anymore. It's about whether a law, regardless of intent, has become a lethal instrument through its effect.
Yeah, and the final thought the sources kind of leave you chewing on is this. What kind of governmental failure is actually more dangerous in the long run? Is it the sudden, visible catastrophe that everyone sees and demands action on? Or is it the slow, quiet, bureaucratic decay? A system that gradually forgets how to even see its own mistakes, letting harm accumulate silently year after year after year.